What if I told you that one decision made in a hospital room, often in a moment of fear, could shorten a senior's life instead of saving it? Not because doctors don't care, but because some procedures carry risks that are far greater than most families realize. Today we are going to talk about something that many families face but few are truly prepared for, and that is the difficult choice of whether or not to agree to certain surgeries in later life. If you are caring for an aging parent, or if you are a senior yourself, this conversation could change the way you think about medical decisions. Take a moment while you listen to share where you are watching from, and if you have ever had to make a medical decision for someone you love, I would truly like to hear your experience in the comments because these choices are never easy and no one should feel alone in them. This topic matters deeply, especially for older adults, because the body changes with age in ways that make recovery slower, complications more likely, and outcomes far less predictable than they are for younger patients. What sounds like a routine surgery can become a life-altering event, and sometimes the most dangerous part is not the condition itself, but the treatment chosen to fix it. 1. Major heart surgery in frail seniors. Procedures such as coronary artery bypass or valve replacement are often presented as life-saving solutions, and in many cases they can be, but for frail seniors the reality is much more complex. As the body ages, the heart is not the only organ under strain. The lungs, kidneys, and brain are often already working at reduced capacity, and a major operation places stress on all of them at once. During and after surgery, the body must endure anesthesia, blood loss, and inflammation, which can overwhelm an already fragile system. Recovery is not just about surviving the procedure, but about regaining strength, mobility, and mental clarity, and this is where many seniors struggle. Some experience prolonged weakness that keeps them bedridden, while others develop complications such as infections, irregular heart rhythms, or even stroke. It is also common for older patients to face confusion or memory problems after surgery, which can last for weeks or even become permanent. What makes this especially difficult is that the expected benefit, such as extended life or improved function, may not always match the reality after recovery. For some, the extra time gained comes with a significant loss of independence, which is something every family should carefully consider before making such a serious decision. 2. Hip replacement after a severe fall. A hip fracture in an elderly person is often treated as an emergency, and surgery is commonly recommended to stabilize the bone and allow movement again. While this approach can be helpful for some, it is important to understand that for many seniors, especially those who are already frail or have conditions like heart disease or diabetes, the surgery itself can become a turning point in their health. The body must handle anesthesia, blood loss, and the physical trauma of the operation, all at a time when its ability to heal is already limited. After surgery, recovery depends heavily on rehabilitation, and this is where many older patients face challenges. Pain, weakness, and fear of falling again can make it difficult to participate in physical therapy. Some develop complications such as infections, blood clots, or pneumonia due to reduced movement. It is also common for seniors to experience confusion or delirium after the procedure, which can delay recovery and increase the risk of long-term cognitive decline. Even when the surgery is technically successful, not every patient regains their previous level of independence. Some may require long-term care or assistance with daily activities, and this shift can deeply affect both the individual and their family. 3. Aggressive cancer surgeries. When cancer is discovered in an older adult, the natural reaction is often to remove it as quickly as possible, and surgery is frequently presented as the most direct solution. However, in seniors, especially those with slower-growing cancers or multiple health conditions, aggressive tumor removal can place a heavy burden on the body. These operations are often long, complex, and physically demanding, sometimes involving the removal of large sections of tissue or even entire organs, which can significantly change how the body functions afterward. The recovery process can be especially difficult for elderly patients. Healing takes longer, appetite may decline, and energy levels can drop to the point where even simple daily activities become exhausting. In some cases, complications such as infections, bleeding, or organ strain can arise, leading to extended hospital stays or repeated procedures. There is also the emotional toll to consider, as prolonged recovery can bring feelings of frustration, confusion, or loss of independence. What is often not fully discussed is that some cancers in older adults progress very slowly, and the surgery may not significantly extend life compared to less invasive approaches. Instead, it may reduce the quality of the time remaining, making it essential for families to weigh not just how long someone might live, but how they will live after the procedure. 4. Spinal surgery for chronic pain. Chronic back pain can wear a person down over time, and for many seniors it affects sleep, mobility, and overall quality of life. When medications and physical therapy no longer seem to help, spinal surgery is sometimes offered as a solution, promising relief and a return to normal activities. However, for older adults, especially those with osteoporosis, arthritis, or general frailty, these procedures carry significant uncertainty. The spine is a delicate structure, and surgeries often involve fusing bones, removing discs, or relieving pressure on nerves, all of which require the body to heal in a very precise way. In seniors, healing is slower and less predictable. Bones may not fuse properly, and existing degeneration can continue even after surgery. The recovery period can be long and uncomfortable, often requiring weeks or months of limited movement, rehabilitation, and pain management. During this time, there is also a higher risk of complications such as infections, blood clots, or nerve irritation. Some patients find that the original pain is only slightly improved, or in certain cases, replaced with a different kind of discomfort. What makes this decision especially challenging is that expectations are often higher than the likely outcome. While surgery can help in specific cases, many seniors do not experience the level of relief they hoped for, and instead face a longer, more difficult recovery that affects their independence and daily life. 5. Emergency abdominal surgery. Emergency abdominal surgeries, such as those performed for bowel obstruction, internal bleeding, or a ruptured organ, are often done under intense time pressure, leaving little opportunity for careful discussion or second opinions. For seniors, these situations are especially risky because the body is suddenly pushed into a state of crisis, followed immediately by the stress of a major operation. Unlike planned procedures, there is often no time to stabilize existing health conditions, which increases the chances of complications during and after surgery. The recovery process can be extremely demanding. Many elderly patients require time in the intensive care unit, where they may be placed on breathing machines or need support for their heart and kidneys. The risk of infections is higher, and even small complications can quickly become serious. It is also common for seniors to experience confusion or delirium after emergency surgery, which can delay healing and make rehabilitation more difficult. Even when the immediate problem is resolved, the long-term outcome is uncertain. Some patients never fully regain their strength or independence, and may require ongoing medical care or assistance with daily activities. This makes it important, whenever possible, for families to understand not just the urgency of the situation, but also the realistic expectations for recovery and quality of life afterward. Let me share something that many families quietly experience. A man in his late 70s, still sharp in mind but physically slowing down, agrees to heart surgery after being told it will extend his life. The surgery itself goes as planned, but the recovery is where things change. Days in the intensive care unit turn into weeks, confusion sets in, muscles weaken, and the independence he once valued begins to slip away. His family is left wondering if the extra time gained came at too high a cost. In another situation, an elderly woman undergoes hip surgery after a fall. Before the accident, she could still walk with assistance and enjoy simple daily routines. After the operation, complications arise, and she never fully regains her strength. What was meant to restore her mobility instead leads to a gradual loss of independence. From a medical perspective, this happens because aging bodies respond differently to stress. The immune system is weaker, healing takes longer, and the brain is more sensitive to anesthesia, often leading to a condition called postoperative delirium. Even when the surgery is technically successful, the overall impact on the body can be profound. Doctors often focus on fixing the immediate problem, which is important, but sometimes the bigger picture of long-term quality of life does not receive enough attention during urgent decision-making moments. Here is the part that many people are never told clearly enough. For some seniors, especially those who are frail, the risk of dying within a year after a major surgery can be significantly higher than expected, not always because of the original condition, but because the body never fully recovers from the trauma of the procedure itself. In other words, the surgery may succeed, but the person may not truly come back to the life they had before. This is why the most important question is not always, can this surgery be done? But rather, what will life look like after this is over? None of this means that surgery is always the wrong choice. There are many cases where it saves lives and restores health, but the key is understanding the full picture, especially for older adults. It is about balancing the potential benefits with the very real risks, and most importantly, considering what matters most to the person involved, whether that is living longer, staying independent, or avoiding prolonged suffering. These decisions deserve time, honest conversations, and sometimes a second opinion, because once a choice is made, it cannot be undone. Approaching these moments with clarity and compassion can make all the difference. If this message resonates with you, take a moment to share it with someone who may be facing these decisions right now, because the right information at the right time can protect a life or preserve a dignity that truly matters. Like and subscribe if you want more conversations like this, and feel free to share your thoughts or experiences below, because your story might help another family make a more informed and thoughtful choice.